Alyssa, you got it. Greatest risk is a previous injury. Previous ankle sprain is your greatest risk of having an ankle sprain. The anterior talofibular ligament is the most commonly involved ligament with an ankle sprain. So here, as we look at the anatomy of the ankle, the image on the left is a lateral view, and the anterior talofibular ligament there is highlighted. Just below that, you can see it, but it's not labeled. The calcaneofibular ligament is the second most commonly involved ligament. Above the anterior talofibular ligament, again, not labeled, is the tibiofibular ligament. When you hear about high ankle sprains, it refers to that ligament. On the image on the right, you see a medial view of the ankle and that thick deltoid ligament. Pretty rare to sprain that guy. Typically, it's significant trauma. Think about maybe somebody in a car accident, maybe a football lineman getting caught up in a pile, that sort of thing. But 85% of ankle sprains involve those lateral ligaments, and only about 15% involve either the medial ligaments or those tibiofibular ligaments. When you hear about a high ankle sprain, it refers to those tibiofibular ligaments. When looking at common practice for treating ankle sprains, clinical practice guidelines get published from a variety of sources. And here you see a list of things that do have strong evidence when addressing ankle sprains. So first, a quality assessment, and we'll talk about each of these individually, but you want to make sure that you're assessing these folks properly. It's very important, especially in the acute phase, to control pain and swelling. And
have been disrupted. Now they have to be picked up and cleaned up. And that, to me, is really our inflammatory stage. Okay. Now, as we move to the next stage, this is happening around day 4 to 21. I think this is really important to note. At Graston Technique, we talk about scar mobilization not being done until the stitches, until the stitches have come out and the wound is completely closed. Okay, stitches are typically coming out somewhere between 7 and 10 days, and we are right in the middle of this, or at the mid-beginning of this third phase. This third phase is so important because this is when the fibroblasts start to form that granulation tissue. Angiogenesis is going to start to happen. Angiogenesis, the formation of these delicate capillaries. The whole purpose of these capillaries is to bring more oxygen into the area. Okay. Now, again, in this third phase, the fibroblasts are going to be absolutely key to us. As we come through this phase, about 3 weeks out, then we have some remodeling that starts to happen, and the tissue is remodeled and it begins to resolve and the wound contraction can occur. In the cases of a larger wound, we're going to have more myofibrils that are going to pull those edges together. In the cases where something has been stitched, less myofibrils present. So at Graston Technique, what do we actually think we're doing?